Today we are going to see about finance in dentistry, part 2. Synopsis are non-profit health service corporations, Delta Dental Plans, reimbursement of dentists, 19th percentile, Blue Cross Blue Shield Association. Next, prepaid group practice. In that, we are going to see types of group practice, advantages for dentists, health maintenance organization, dental personals in HMOs, capitation plans, public programs, financing dental health services in India. Conclusion. Now, coming to non-profit health service corporations. First, Delta Dental Plans. A dental service corporation is a legally constituted non-profit organization incorporated on a state-by-state basis and sponsored by a constituent dental society to negotiate and administer contracts for dental care. National Association of Dental Service Plans, June 1966. Next, the NADSP changed its name to Delta Dental Plan in April 1969. Coming to philosophy, dental practitioners can adopt their traditional patterns of practice to meet the demand for group purchase for dental care. Board of directors or dentists. Others were finance, insurance, consumer groups. Next, the reimbursement of dentists in dental plans. They use the UCR concept depends on participating dentist and non-participating dentist. In participating dentist, any duly licensed dentist with whom a Delta plan has a contractual agreement to render care to covered subscribers. Non-participant dentist, a dentist who is out of network with a dental benefit plan. Conditions for participating dentists under Delta plan. Pre-filing of their usual and customary fee, acceptance of payment for their services at 19th percentile of fees as payment in full, fee audits by auditors from Delta plan, post-treatment inspection of randomly chose patients, withholding of a small amount of each fee to go into the Delta Capital Reserve Fund. Next one is 19th percentile. Example, 1,000 participating dentists in area, the fees range will be rupees 50 to rupees 90 for an oral prophylaxis. The percentage of data set divide the total frequency into hundreds so that the 90th percentile is a value below which 90% of the observation will be live. Next, payment at 19th percentile, payment of rupees 78 or their actual fee, whichever is less, is paid to the participating dentist. At 50th percentile, payment of rupees 65 or their actual fee, whichever is less, is paid to non-participating dentist. Next, Delta Dental Plan. They ensures quality of care, keeps a program cost within limits. The care claimed and paid for has been provided, then they accept the quality. Next one is Blue Cross Blue Shield Association, a federation of 38 separate health insurance organizations and companies in the United States, directly or indirectly provide insurance to over 99 million Americans. Blue Cross Association in 1960, Blue Shield in 1948, they were merged in 1982. They offered limited dental coverage as a part of medical policies. Prepaid group practice. A group practice that provides dental services on a prepaid basis, open panels. AD definition, a group practice is the type of dental practice in which dentists, sometimes in association with the members of other health professionals, agree formally between themselves on certain central arrangements designed to provide efficient health services. Coming to types, general practice group, single specialty group, and multi-specialty groups. Advantages to the dentist, better ways of organizing one's life, less disruption in the practice caused by dentist illness, improved quality of care, financial fringe benefits. Next one is health maintenance organization. Definition, a legal entity which provides a prescribed range of health services to each individual who has enrolled in the organization in return for a prepaid, fixed and uniform payment. Then principles of an HMO. It's an organized system, is a reimbursement, and enrolled group, comprehensive health maintenance, and treatment services. An organized system, HMO must be capable of bringing together services for physicians and other healthcare professionals with services of inpatient and outpatient facilities that a defined population might require. Comprehensive health maintenance and treatment services. Primary care, personal physician care or entry point into the system from which referrals to specialists are made. An enrolled group, people who voluntarily join the HMO through a contract arrangement in which the enrolled agrees to pay the fixed monthly or other periodic payment to the HMO. Enrolled agree to use the HMO as their principal source of health care if they become ill or need care. Reimbursement. HMOs use a prepaid capitation system of financing services. Only a small portion of HMOs offer dental services. Dental personnel in HMOs. Staff model, group model. In staff model, dentist, dental hygienist, dental assistants are salaried employees. In group model, HMO contract directly with a group practice, partnership or cooperation for provision of dental services. Next, Independent Practice Association, an association of independent dentists or physicians that develop its own management and fiscal structure for the treatment of patients enrolled in HMO. It's an open panel. Primary care capitalized network, similar to IPA, but HMO contract directly with the individual provider for provision of service. Provider is at risk. Next is capitation plans. Basis of capitation. The contracting provider, HMO, group services, IPA, or individual dentist receives an established negotiated sum on a monthly or yearly basis for each eligible patient. The money is paid, patient utilizes care or not. In return, the patient receives a prescribed set of services over a specific period. And next, third party carriers, private entrepreneurs also involved in marketing, open enrollment, limited services, low risk, more valuable, attractive to both purchaser and provider. Next, salary. Dentists in some group practices, armed forces, public agencies are salaried. Advantages are dentist free of business concerns, allows to focus on clinical practice, fringe benefits. Disadvantage is in the lack of financial incentive. Coming to public programs, aim of this program to meet the needs of specific group of recipients in this diverse society. Government sponsored and include community health centers. Public financing of dental care, where Medicare, Medicaid, and National Health Insurance are included. Coming to Medicare, it was started in 1965 in USA. This program removed all financial barriers for hospital and physician services for all persons aged 65 and over, regardless of their financial means. Part A, hospital insurance. Part B, supplemental medical insurance. Next one is Medicaid. Aim to provide funds to meet the healthcare needs of all indigent and medically indigent individuals. They cover inpatient hospital care, outpatient health care, laboratory and X-ray services, skilled nursing facility services, family planning services, physician services. Next one is National Health Insurance, a financing mechanism by which healthcare services are paid for from a publicly organized fund. Financing dental health services in India, fee for service. Majority of dentists provide dental service on a fee for service basis. Other providers, private hospitals and doctors, facilities of private firms, enterprises, medical education or research. Dental insurance not only covers dental treatment which require hospitalization, but also covers dental checkup, oral prophylaxis, restoration, and dental extraction. The premium varies with coverage. Next, free or discounted rates. Free or discounted health services provided under publicly funded government, hospitals of the state government, dispensaries of the state government, health centers, rural and urban family welfare centers, facilities of various central ministers. Next, facilities of employee state insurance scheme in 1948, facilities of central government health scheme in 1954, facilities of autonomous institutions and societies. Coming to conclusions, The financing of dental care is well developed and well practiced in countries like US. However, in India, fee-for-service is still the most prevalent form of availing dental services. Although the free dental services are provided by the government at some of the health centers, it is scarce and insufficient. Thank you.